The medical director of NHS England says the mass vaccination programme for COVID-19 starting this week marks the beginning of the end of the pandemic. But Professor Stephen Powis warned it would take many months to vaccinate everybody who urgently needs protection. Batches of the vaccine have started to arrive at hospitals. Around 800,000 doses are expected to be available across the UK this coming week, with jabs starting on Tuesday. Our science editor David Shukman reports.
An unmarked van at Croydon University Hospital in South London with a delivery that could start to change the course of the pandemic. Inside these boxes, the first vaccines for COVID-19. Ingenious research is creating light at the end of the tunnel.
This is just so exciting. It's a momentous occasion. The NHS has been planning extensively to deliver the largest vaccination programme in our history, so it's really exciting.
The vaccines have to be stored at -70. Only large hospitals can do that, so distribution is complicated and will take time.
NHS staff around the country have been working tirelessly to make sure that we are prepared to commence vaccination on Tuesday. This feels like the beginning of the end, but of course it's a marathon, not a sprint, and it will take many months for us to vaccinate everybody who needs vaccination.
So far, only the Pfizer-BioNTech vaccine has been approved in the UK, so it's the one that's being used first. The rollout of this vaccine will involve an operation on an extraordinary scale. There are something like 6.7 million people judged to be the highest priority. Residents of care homes, for example, and the over 80s. So that requires 13.4 million doses because everybody has to have two. Now, it's hoped that there'll be 800,000 available in the coming week or so, with up to 5 million by the end of the year. But however this pans out, it's going to be a huge challenge. Production is slower than hoped at Pfizer's plant in Belgium after problems with raw materials. But other vaccines may come on stream soon, like the one by Oxford University and AstraZeneca, now awaiting approval.
So I need a scratch.
The key factor in all of this is the readiness of the public to get vaccinated. The medicines regulator wants to reassure people.
I would really like to emphasise that the highest standards of scrutiny of safety and of effectiveness and quality have been met, international standards. And so there should be real confidence in the rigour of our approval.
So we're on the brink of the first big step out of the crisis, but there's a long way to go. David Shukman, BBC News.